Let's talk about it. Each Friday at this time, hosts Dennis O'Brien and Susan Johnson interview guests who are involved in their community. The show challenges conventional thoughts, probes for answers, remembers the past, imagines the future, and gets to the heart of the matter. Let's Talk About It is brought to you by Columbia Ford Kia, Route 6 in Columbia, Connecticut, and Gates GMC Nissan, Route 66, the Boston Post Road, North Windham, USA. Opinions expressed do not necessarily reflect those of WILI staff, management, or sponsors. Now, let's join our hosts with their guests and let's talk about it.
Hey, good evening, everyone, and welcome to another edition of Let's Talk About It. This is Susan Johnson, and I'm here with my co-host, Dennis O'Brien, and our very special guest this evening, Congressman Courtney. We are so thrilled to have you here to join us to talk about all the things you've been through in Congress. And I might add a few things about the special session that we were in this last week here at the state capitol, directly related to what happened because of the billionaire bill. And as I refer to it, and it does help the billionaires. But we really had to set some money aside. But before that, we're going to just have Congressman Courtney talk a little bit about some of the things that happened with the shutdown.
Sure. Well, thank you, Susan, again, for hosting me this evening, and also to Dennis. And really admire your program and how long you guys have been committed to it.
Hey, when we started, you were one of our most frequent guests.
Yeah.
And we just loved having you on the show, and we had you on 3-4 days before the election of a famous election of 2006.
Right.
When you first went to Congress, and it was very exciting to have you here a few days before the election, and as we all know, it turned out well.
It did. It was took a couple weeks to find out the
that's right.
the final outcome with the recount. So anyway, this week the shutdown of the government came to an end, and the shutdown of the House of Representatives also came to an end. So the government shut down October 1st. So it ended up being about 43 or 44 days. But the Speaker of the House shut down the House of Representatives on September 19th. So we were actually, that chamber was completely dark for over 55 days, which is ridiculous because aside from, dealing with the issues of reopening the government, there's a lot of other issues out there that needed to be dealt with. And it was really shocking because this is my third sort of real shutdown that was of any length. Mm-hmm. And when John Boehner was Speaker in 2013, he had us in there around the clock, which he should have. That's how you work out a deal to bring things to an end. And Pelosi was there in 2019, and same thing. So Johnson basically thought, he was going to try and jam the Senate by just, passing this hyper-partisan bill and then just leaving town. And, it ended up with a bill that actually looks different than what Johnson passed on September 19th. And I really just, first of all, want to emphasize to your listeners that, we were not voting yes or no, do you support shutting down the government or opening the government? Every rational person is opposed to a government shutdown.
Absolutely.
It makes no sense. The question that you're voting on, though, is the bill in terms of, how are you going to fund the government to sort of get the lights turned back on? In past years, it has always been a bipartisan negotiation. And in this year, it has just been a totally one-way street. Our way or the highway. Was kind of the approach that took place. So the bill that came back from the Senate, it did fund many of the departments and agencies, the Department of Defense, and Homeland Security, and Health and Human Services, Education, etc.
Agriculture.
Right, but what they and they funded at the same level as last year's spending bill, which is kosher. That's completely cool with that.
Right.
But what was missing is that the program that's been on the books now for 4 years that extends subsidies for people who are buying health insurance through the Affordable Care Act was eliminated. So, 4 years ago, the subsidies were boosted to try and increase enrollment. It was 11 million Americans were participating in the exchange back then, and now it's 24 million
Right.
Americans. And so, so it was really not a clean bill, which is what people kept saying. Because a clean bill was you just keep it. It continued. You continue the status quo that was there, and it was not anything of the sort. And the second thing, which we were talking about afterwards, it was. I mean, it's almost hard to describe because it seems so wild and crazy. Is that the head of the Senate Republicans put a provision in called a private cause of action that allows 8 senators to sue the federal government because of a subpoena that was put out during the January 6th investigation for people's phone records. Again, there are certain protections for the speech and debate clause, for people who are in Congress, but that does not basically allow me to go out and go on a crime spree. I mean, you're still subject to federal law, and they were investigating again whether they were involved in aiding and abetting the insurrection that was there, and all they were really asking for was just who were you talking to? Were you talking to the Proud Boys or some of the other groups that were involved there. So anyway, this provision in the bill allows them to sue the federal government if they can prove that they were subpoenaed, which I don't think anyone's really disputing that. It entitles them to a minimum of $500,000 judgment or more if they can prove even more damages. So I mean, think about that. You're a legislator voting on a bill that gives you, Susan Johnson, the ability to sue the government and collect a minimum $500,000.
Yeah.
And so, I mean, the House Republicans were outraged as much as the Democrats were because it's just what is this doing in here?
It's bipartisan work with the House Democrats and Republicans on the federal level.
Right. So. Because, that's not continuing an existing program or government. So, I mean, Johnson, Speaker, says he's going to bring up a bill next week because we go back to D.C. on Monday to strip it. But who knows what the Senate's going to do? I mean, they passed it already, know, and they need to get 60 votes to pass a bill.
Right.
So, again, I just want to make sure people understand that what should have happened was the two sides should have gotten together and make it a truly clean bill, which was basically if you're on if programs are in place, you just continue keeping them current. And because that healthcare piece was knocked out, and this, I mean, starting on November 1st, people started enrolling in the coverage for 2026, and the first bill has to get paid on December 15th if you want to get coverage on January 1. So, I mean, we have no time in Congress. We've got to restore the support so that people aren't going to fall off a cliff. And again, the stories are unbelievable. We had a couple from Norwich, 20 years small business, a martial arts studio, where kids go to but also adults. Been around for 20 years. They were paying $800 a month premium for their small plan. It's going up to $1,900 a month because the subsidies are gone. I was with a couple in Enfield who are in their 60s. They're paying about $300 or $400 a month for a plan for the two of them. It's going up to $2,300.
Yeah.
Because
a month.
Because and that's there's still deductibles and co-payments and all that stuff. So and again, I could keep going here in terms of because we had a town hall with 10,000 people on it who were calling in with similar type stories. And
I have people calling me as well about that. I've had people contact me about how I said, well, did you get the notification about your new premiums? Oh, yes. Well, what are they? These people are self-employed people that are doing these small jobs, but just keep themselves afloat. And, it's going to go up $200 a month. And so there you go. It's, $2,000, almost $2,500 a year for a very low-income person. So that is really how it is. And one of the things, too, that under the Trump administration in the 2016 to the 2020 period, that I worked on for a while, just to make sure that we were able to keep the Affordable Care Act in place, was looking at the regulations, because the regulations, they worked really hard to change so that the tax credits to the businesses weren't going to be provided to the same extent, and that the Medicaid subsidies that go up to 400% of poverty weren't going to be able to get the same percentage in terms of that coverage. So we worked really hard to try and make sure people were able to stay in the Affordable Care Act and that they didn't crash it. This particular bill is to crash the Affordable Care Act.
No, there's
That's
no
exactly
question
what
about
it's
it.
about.
Yeah.
I mean, it's not giving any more subsidies, and so what happens is then people will have to go off, and I don't think that people fully understand that the loss of the subsidies and the Affordable Care Act create a situation where people won't be able to afford, what you just said,
Yep.
their premiums, but it's because of tax credits that the little businesses and even bigger businesses get when they participate in a health care plan that doesn't discriminate against people because they were pregnant or because they had some injury. Some kind
Or
of thing,
cancer. Yep.
cancer,
Yep.
something like that, and so then the discrimination, then your health care goes skyrocketing, and the other thing is you have a lot of fast and loose types of insurance programs that will give you a very nice premium but a very high deductible, and then guess what, you won't be able to use your health insurance because the deductible is so high you never are going to be able to reach that, and if you do because you get cancer or something, then the doctors aren't going to get paid and the hospital isn't going to get paid because you can't afford to meet the deductible requirements.
So during the break, that Speaker Johnson, imposed with shutting down the House, I went and visited some brokers, one up in Ellington and one down in Groton. And again, these are, guys see their signs on the window, that they do auto and home.
They're everywhere.
Exactly. So, but I mean, they're obviously right there in the real world with people who are coming in and seeing these new premiums. And basically, when people are seeing these, just, we're talking, 100% increase per month or even higher, like the couple up in
Yes.
Enfield. So some people are like, okay, I'm going to have to borrow from my 401k account to pay it. Well, of course, you get a tax penalty, right? If
Right.
you do that. So
Yes.
it's like a double whammy.
Yep.
But again, if you're in your 60s, I mean, honestly, and there was a couple instances, one in Enfield and one in Stonington, where they just said, you know what, health insurance, I have to have health insurance at my age. I'm not going to gamble on this thing.
Gotta have it.
But then there were other instances where the brokers were just telling us people were basically, when they saw the numbers, they were just like, screw
gonna
it.
pay.
I'm just going to gamble that I don't get
Right.
sick.
Yeah.
Right. A lot of
And-
people
and-
do that. Yeah.
And I mean, so we're turning the clock back to before 2010.
Yes.
And all these horror stories of people who don't get diagnosed early because they don't have primary care and preventive health care and all that. I mean, it's just it's really taking a step back, and it's really there was no excuse for it.
None at all.
The money was there. I mean, obviously with the billionaire tax cut,
Yeah.
there was more than enough money that
Sure.
was there, and we the attack on this issue by the Republicans, it never stops.
Right. They've always historically, and I won't go into the whole history
Yeah.
because I did a
Come
class
on.
for Denise Merrill. I did
We
a
know
class
you
for
can do it,
Denise
so-
Merrill, and I went back 100 years,
But
and
you
I
two-
just want to say that
You
there's
two
a lot
guys
of
know more about this stuff than anybody in the whole world.
Hey, I'm talking. I just want,
All right.
I just want to say that there's a history of race discrimination in this analysis. That if you go back to the turn of the last century, where you had your black hospitals and your white hospitals, and these things were not mixed until the Medicare and Medicaid program went into effect. And then the hospitals and the practices couldn't get funded unless they mixed the races.
Integrated.
Yeah, and so that was what happened, and that's what the Medicare, Medicaid, and the Republicans were against, as we all know. Not one voted for Medicare and Medicaid, not one voted for the Affordable Care Act, not one voted for Social Security under FDR. Never, ever, ever have they ever voted to support the people. And they have continued that all the way through. And so what will happen, though, is the other aspect of this, and this is something that really scares me too, in addition to people being hurt, not being able to pay, well, if you can't pay, the providers can't continue. And this is going to hurt more of the rural hospitals, which they've already started shutting down. And I'm concerned because of the way the Emergency Medical Maternity and Delivery and Treatment Act of 1986, EMTALA, requires that the hospitals take everybody, and if they're not going to get paid, then how can they continue? Because they won't be able to pay anybody, they won't be able to pay their bills, and then they just say, hey, we can't do that. If you can't afford to provide the service, then you can't do the service.
So, I mean, when we go back next week, we already have filed a bill to extend the subsidies, which again disappeared. But it's honestly, it's going to be like lightning's going to have to strike to get that to move quickly enough to rescue people's enrollment that's there. And that's the thing that, we can do this in January, and it's just like, you're totally disconnected from how the program works.
Well, they are, and I think that is another reason that the shutdown worked. The reason, in my mind, the shutdown in the Senate worked was because nobody knew what was in the big billionaire bill. Nobody understood that it was going to take health care and shut down hospitals, shut down providers, and then all of a sudden one of the most vociferous MAGA congresswomen, Marjorie Taylor Greene, said, my daughters aren't going to be able to afford the Affordable Care Act
100%
anymore.
100% increase in their premiums.
Yes. Yeah. And so you know that that side of the aisle didn't understand what they were voting on.
Right. So, one thing I think when we look back, what just happened, a week and a half ago with the election locally, and then, California, New Jersey, Virginia, even Mississippi and Georgia. I think the public is catching on big time.
So.
And I think, obviously the result here in Willimantic,
That's
congratulations to the mayor and, the whole slate there. And, but again, if you, if these guys were really paying attention, that, New Jersey, which Trump only lost by 6 points and carried Passaic County, and Mikey Sherrill, who's a great colleague in the House, swept to a 14-point win.
That's fabulous.
And flipped Passaic County.
That's a big win.
No, it's huge. And Virginia was a really strong result. And again, another great former member, Abigail Spanberger, and but New Jersey, in some ways, I think was really the most powerful.
The margin of victory was incredible.
Right, and that Trump's support, which was shocked people in 2024 in that state, has really eroded. The California members, I was catching up with them Wednesday night, while we were killing some time waiting for the vote, and the description of the lines of people for Proposition 50 was just, and again, there was nothing else on the ballot.
That's amazing.
They were there to vote for a proposition.
That's right.
I know. Can you imagine?
That was amazing.
We've been through a few rodeos.
Yes.
On
I had to check it out and see what else was on the
by that.
ballot, and there was nothing else. Amazing. So important.
Yeah.
Very important.
Yep. So,
it's great.
So anyway, that's what, we thought maybe between Marjorie Taylor Greene, and there were some other, there was a couple members from New Jersey, actually, who were really sweating it because of the subsidies and, what they were hearing from their constituents, that maybe, it might finally penetrate and we could get something. But, they just slammed the door shut.
Yeah, well, Trump's control is
Right.
is
Iron
vast.
fist.
It's
Yeah.
ironclad, but it is. You're right. It is diminishing. The problem is we don't have another election
Right.
until your next election in the fall of 2026. But I
There's actually one this week in Tennessee to film Mark
Okay,
Greenseat,
yeah,
which
okay.
That's a
important.
tough race.
Tennessee's gotta be tough, yeah.
But there's already kind of some vibes coming out of there. That
Yeah.
This thing's gonna be tighter than anyone ever expected.
Yeah, I think the rallies are
That's great.
working.
Yes.
I think the rallies in this election I was looking forward to it because I thought it was going to send a message, and it has.
Yes.
And it was very gratifying to be there, celebrating our victory right here in town here with my good friend Adam Richards.
Yes.
Yeah, and that was,
Yes.
that was fantastic.
Yeah.
And we were happy locally, but we were also happy. But we were watching the whole country to see what was going to happen.
as
Because
Adam-
that's what it's all about.
As Adam knows, I mean, there were some towns that flipped in eastern
Oh, yeah.
Connecticut. I mean, Enfield, which is the biggest community
Yeah.
in the district, went straight
Right.
across the board Democrat. And honestly,
That's great.
I know a lot of the folks that were campaigning there. They, the woman who knocked out in the district, the council district in Enfield, where the Republican mayor lived.
Yep.
She like walked into headquarters. She had already promised the mayor that she'd buy him dinner when he won.
Right.
She walked into the headquarters. She won by almost 200 votes. Her district, she burst into tears.
Wow.
70 years old, never campaigned, never ran for office
Wow.
before.
Good for her.
Well, in my
She hustled
hometown
out.
of
She worked
Oh,
hard.
I'm sure you have to.
my
Yeah.
hometown of New Britain, which is out of your district,
Yep.
Bobby Sanchez,
Yep.
great candidate.
Oh, Bobby
I
won.
figured he was going to win because he wasn't running against an incumbent, but a popular incumbent,
Yeah.
albeit. But he won a great victory, and it was just great to see in my hometown of New Britain
Yeah.
a Democratic mayor again. And it was happening all over the area. And it happened in some towns in eastern Connecticut as well, which is great.
Yeah.
And I worked with Bobby Sanchez, Representative Sanchez. He's he's just resigned just before a special session started this week. But he was the chair of the education committee, and he was a great person to work with. And I know he's going to do a great job for New Britain. He's just really
Bobby
good.
Sanchez was also a big fan of Wyndham Willimantic.
Yes.
He was out here often.
Yes,
Yep,
yes,
yep.
he liked us.
A good
He got
friend,
it.
and we were there in New Britain with him.
Yep.
And a good man. Anyway, you got a lot to talk about.
Yeah.
Yeah, there was a couple other issues which I wanted to
Yep.
mention
Yeah,
to you. Again,
yeah.
knowing Susan's interest in healthcare.
Right,
But
yeah.
one thing I wanted to share is that right starting really in January,
Uh-huh.
we were getting calls from UConn administrators about the fact that research grants were being completely canceled and withdrawn that actually had already been pretty much approved and obligated.
Right.
And I mean, it's the last tally that I saw was about $45 million worth of grants. As you know, I mean, these things are done with lots of human backup, in terms of graduate students doing the scut work.
Absolutely.
And but that's how they learn, and that's how they
It's part of the
make
learning
sure
process.
that the research is good that's there. And when you look at some of the areas that they were researching, cancers and
Sure,
obesity
yeah.
and a whole range of education issues in terms of learning disabilities. This is not like some lucrative Bitcoin cryptocurrency deal or anything like
Exactly,
that. This is like
exactly.
actually trying to help people.
This is meaningful.
That's
it's
there,
practical.
and
it's
and,
loving.
and
and
I
caring.
had a woman from Old Lyme come to Washington who was suffering lung cancer.
Oh,
She was
yes.
stage 4, non-smoker, by the way,
Right. Yep.
and she was going through clinical trials up in Boston with one of the hospitals up there. And it was either Harvard or MIT. Was sort of doing the research there, but she was just about to start this new cancer treatment, mRNA. Which
Yes.
is what was used for COVID.
Yes.
That's there, and there's really a lot of excitement about that as a potential in terms of really taking a big step against cancer. And RFK just canceled the whole program because he has this complete sort of like thing about mRNA vaccines.
Well,
That's there.
he obviously doesn't understand genomic science, and mRNA was a part of the genomic research that's been going on, by the way, in agriculture since the 70s. It's not like it's new. And if anybody's been watching Jackson Labs here, I mean, that is what genomic research does. That's how we got it. By the way, did not start under COVID. It was one of the other flus that started in the early 2000s, late 1990s, that they utilized genomic research. And so this is something that is not. It is rocket science. It's genomic science, but it's something that we've been able to conquer in terms of analysis now. And we have the human. We got the human genome completed back in the late 1990s, and we were able to come up with these treatments and cures for all different types of diseases. And so it is incredible that he's that ignorant.
And really looking her eye to eye, in my office there. I mean, it just, you're
Yes.
kind of like you're speechless.
Yes.
In terms of how
It's stunning.
mean,
Incredible.
and nasty, that is to,
Well,
to
that's
the
right.
people who. So I mean, 60 Minutes did a really big segment again on the research and development, and aside from again the patient care, like the constituent from Old Lyme, and all the need to keep doing more that's there. We're really taking away America's edge as a leader.
Yes.
In terms of, and that's the
We're gonna
thing.
give
'cause
it to
what-
China,
'cause
right?
what it, and or Europe. I mean, what I think UConn is finding is that a lot of graduate students, and it's not just UConn. It's other U.S. colleges and university, which used to be a magnet for kids overseas who wanted to get to the cutting edge best, are now sort of heading in the other direction. And that long term is going to really take away what I think makes this country so special in terms of innovation. And,
Exactly.
They're on the way.
Yeah.
Well, I'll never
They're
forget when we allocated several $1 million to Jackson Labs to get them to be able to expand, and there was a lot of discussion on the floor saying, "Oh, this is too much money," and all this, and then all of a sudden, Jackson Labs, which does the genomic research, which is how we got these vaccinations for COVID and before that, has taken it's an international place for genomic study, and they're getting money from all over the world. And so we're going to shut that down now when we're bringing money in to that Jackson Labs from all over the world for that genomic science. So that is just it's beyond idiocracy.
Yeah.
Anyway, this is Susan Johnson. We are going to be right back after these great messages. Welcome back, everyone. This is Susan Johnson. I'm here with my co-host, Dennis O'Brien, and our very special guest, our Congressman Joe Courtney, is here. And we're going to talk some more about some of the things that are going on in Congress, and I might talk a little bit about what happened in special session as well. So, yes, you're going to tell us a little bit more about the billionaire bill
Sure.
that has cut the Medicaid program.
So on July 4th, the president signed into law H.R. 1, the billionaire bill, the misnamed One Big Beautiful Bill.
Just to be clear.
Which, again, did a number of things which, the two big hits in the bill to pay for the tax cuts for the, top 1% and corporations was the Medicaid program, which basically took a $1 trillion
Right.
hit over 10 years, and SNAP, which is the Special Nutrition Assistance Program, or Supplemental Nutrition Assistance Program, which took a hit of about $200 billion. And again, that's we went through this horrible SNAP cliff over the last couple of weeks or so. With the government reopened, USDA is now, at least for the month of November, going to replenish everybody's EBT card
Right.
and any money that the state of Connecticut expended to try and make sure people
Good.
were made whole. That's there. But starting on December 1st, H.R. 1's cuts to SNAP start kicking in. Medicaid cuts are really pushed off to 2026, which was obviously a gambit to avoid the election consequences.
Right.
But SNAP, it does kick in December, and I will tell you, I was down at St. Vincent de Paul place in Norwich the other day, where DSS did a briefing in terms of what the SNAP changes involved,
good.
which is, again, it's a work requirement.
Yeah.
The exemptions for, like, let's say a family with a disabled child, now, they were assuming that, at least they would still get full SNAP benefits until the child turns 18. No, actually, once your child turns 14, everybody's got to go out and find work. Again, you could have an autistic child that requires, round-the-clock care, or some other, chronic disease or illness, and there's, no flexibility as far as protecting people in that situation. The work requirement goes up to age 60, I believe now.
Yes, right about there. The other thing is that 75% of the people on Medicaid program in this state are working.
Right.
They're working. Same with about the same with the SNAP benefits. So we've got 75% of all these people. Yet the burden is on the state now to prove that they're working, and they have more data to provide to the federal government. And then if a little mistake is made, we're going to get charged,
Yep.
dinged.
Yep.
My thought exactly.
Yep.
Charged, dinged, and that's going to cost the state money. And we're going to have to, in some of these circumstances, go through reconsideration periods twice instead of once, and that's like doubling the volume of people who actually are on these programs. And so it's just a terrible situation. I just want to say that's one of the things that we did we brought out $500 million in special session to try and make sure people are not put in harm's way with respect to the SNAP benefits and the losses. Not only that, we had this Covenant Soup Kitchen here, and apparently DOGE, with the Musk cuts, got rid of the
TFAP.
Yes.
Yep, the emergency.
The emergency food, exactly. And so we're at about 400 pounds of food a day here. We deliver 1 million meals a year, and we have a pantry. We have 3 pantries, the Axis pantry, the Covenant Soup Kitchen pantry, the Salvation Army pantry. So we have all that here in this town of a little bit less than 25,000 people. We do shoulder the burden for the region and for the people here. And and I'm saying this because I want everybody to know who listens, and who we will blast this podcast throughout the state so people will know what we do for the region and for the state.
No, that's true. So when the SNAP was turned off on November 1st, which again was completely intentional. I mean, there was a contingency fund that would have kept people's EBT cards replenished. That was there. But I was at Access Agency a day or two after that, where again they set up an emergency drive-through drop-off at the pantry there, and a lot of it was donated from the area. Probably almost all of it.
I think it is almost all.
Cash or food, and they did a fantastic job. But I mean, clearly, it really kind of demonstrates how efficient the EBT SNAP benefits are when you can just get that in your phone, go right into the grocery store. The average is between 5 and 15% of customers in most grocery stores are using SNAP benefits. So, by the way, it's pretty good for grocery stores.
Exactly.
And
absolutely.
And let's be clear about some of the myths. Nobody can buy alcohol. Nobody can buy cigarettes. Nobody can buy any of those kinds of things. It's all about food.
Right. And also there's a citizenship screen. So this, and that's true of also the Affordable Care Act subsidies and Medicaid, which is that if you're not lawfully in the country, the computer systems are automatically set up to spit the applications back. I mean, and Speaker Johnson finally stopped using that accusation that it was free health care for illegals, which
Wrong.
The ACA is not free. Number one, as I mentioned earlier, the people who are on the program are paying real money for their monthly premiums. It's just they were not paying so much that they basically were have nothing else to pay for rent or food.
That's right.
Which is what is going to happen. And again, if you are undocumented or illegal, they say you're not eligible.
No, that's so true for all the programs. It's been such a myth that undocumented people are qualifying for all these programs when they just are not, and that is just an incredible myth that's been perpetuated to just stir the pot, apparently.
So one other issue which we talked about off the air was the fact that and we got calls in our office about it, was that the Department of Health and Human Services, which runs the Medicare program for people over 65 and on disability, announced that they were doing a pilot program in 6 states to require prior authorization of medical care that has already been ordered by a person's physician who's on Medicare. So, as you know, well, and I think hopefully a lot of your listeners, but maybe not, is that if under Medicare Part P, if a doctor prescribes a medication or some type of therapy or some type of treatment, that's it. That's the way
right.
the law is written. If it's medically necessary, Medicare covers it. What this pilot project would do is require that any of those doctors' prescriptions would have to be screened for full authorization, just like a lot of insurance companies do, and that the authorization would be done by artificial intelligence.
My God.
Yeah. So
I'm glad we don't have it here. They didn't pick on us for this
they
one.
didn't.
Well, but I sat on the Insurance and Real Estate Committee for 3 terms, and that was one of the things we constantly tried to stop the insurance industry from doing. We can certainly regulate to some extent what goes on with Connecticut insurance policies, and we have worked very hard to stop the insurance industry from doing the prior authorization. But what does it do? It holds up the treatment that somebody who has cancer and could actually be delayed to the point where they will die.
Yes.
It holds up all kinds of different types of treatment that will cause somebody to have more of a disability than they already have. And so by not taking the doctor's word, because the doctor is going to understand exactly what the person needs, and it may not be in the bell curve of what is in the AI analysis. And so by utilizing the AI analysis, we are not going to be able to make sure people get the care that the doctor knows that the person needs. And so I would say that is a horrible idea. I'd say that what we really need to do is make sure we stick with the doctors and stick with the people who are seeing the patient. And it's been something that I've worked on for now probably more than 40 years of my life. First with the legal assistance to Medicare patients, then with the Center for Medicare Advocacy, then I got to the Capitol. I'm still working on it. But having prior authorizations is a horrible, horrible idea. And you really need to have that connection with the provider. The provider is where the ultimate analysis should be, and putting it in the hands of AI is just it's not the way to go.
No,
So
one of the reasons why Medicare is so popular, and it is the most popular form of insurance, year in and year out, and
it's public,
is that you're again don't have to do these Mickey Mouse gymnastics that you have to jump through
all the administrative red tape.
I mean, Medicare Advantage is administered by insurance companies, and frankly, that's been a complaint also by people, is that it sort of operates the same way. But Medicare Part B, the traditional sort of
the fee-for-service,
which this pilot program is aimed at, is something that, again, they're trying to sort of hijack into this.
They've been hijacking.
With
the Advantage plan, of course, is as you know, is the capitated system where the Advantage plans say, hey, to the government, we're going to take this 1,000 people, we'll give you, and you're going to give us $2,500 a person, and then we'll take care of them. We promise we're going to, under our contract, we're going to do the same thing that Medicare does, and then all of a sudden the appeals process is a little bit different. Oh, by the way, you can't do any Freedom of Information request. Why? Because it's now a trade secret. They can't really tell you what they're doing with the patients. And so lots of people don't get access to care because they are limited in terms of access, even though it's promised in a contract that they're supposed to get the same coverage that they got when they were fee-for-service Medicare. And they'll give you some free food, but when it comes time for your cancer treatment, it's too expensive, or we're going to wait and see,
So before I get off, or we run out of time here, I did want to share with you that Adam and I actually just came from down in Ledyard. We visited an apple orchard down there, which, it really smelled so good in there.
That'd be great.
So, but the farm wanted to share a story in terms of Trump's tariffs, in terms of the impact on. So they, really smart, trying to figure out ways to make the farm work better. Did some traveling around the world, and they saw that there's apple sorting machines in Europe that actually do use AI, but in a good way, okay?
Yeah.
Where, basically you can sort the apples, take out the ones that are maybe bruised or rotten or whatever, and also be able to sort them by what kind of apple it is, because the thing can see with the color. And Adam's nodding his head. I mean, it was ingenious and it was made in Poland, and it was a bunch of young guys who sort of figured this thing out. And so anyway, he ordered this equipment in January, and Trump gets sworn into office, and Liberation Day comes into effect, where he's putting tariffs on countries totally indiscriminately, with no rationale. Countries like Australia that we have a trade surplus with, and this machinery is on a ship making its way to New Jersey to be delivered, and he gets a notification that he's going to have to pay a tariff of 10%. The equipment was around $100,000.
Oh my God!
So that was $10,000 that was added to the cost of it. Plus, he had to all these other sort of expenses in terms of just the brokers who have to sort of figure this stuff out and make sure it gets paid to the Department of Homeland Security. Sure. He had another piece of equipment that he got in Canada that again was sort of sweeping up apples that were, sort of had fallen, and there's some of it you can use for hard cider and stuff like that. And same thing, it was about a $55,000 piece of equipment, and he got whacked for another $6,000. And it's he actually listened on the radio to the oral argument at the Supreme Court, where they just
he was listening to part of that. Yes.
Yeah, and
C-SPAN,
honestly, even the conservative Republican judges, this is an Article I power. It's a tax, right? It's
exactly.
a tax on imported goods.
Seems like a tax to me.
Yeah, it certainly seemed a tax to the farmer.
Absolutely.
It certainly does.
$10,000 tax, yeah.
So anyway, we'll see what happens. But, the one point he was making was that, some of the discussion is, well, what are they going to do in terms of all the, the tariffs that were collected? And he goes, I know the answer to that question, which is you should send it back to the people who paid it, because it was illegal. To do that. So I just thought that's kind of a pretty powerful story in a way.
It truly
just
is.
A farmer
Huge.
who's trying to, improve his operation, and keep land in farming and agriculture.
Sure.
And these tariffs, and they really have hit agriculture pretty, hard in terms of equipment and fertilizer and all the inputs that go into farming have gotten whacked.
Yeah, well, I just want to say that's a positive aspect of using AI.
Yes, no, that's right. No, it was we were
You're gonna pick some
watching.
apples on that.
Developing that machinery.
Yeah.
They said sons of
great.
Eli Whitney.
Yeah.
That's
It
great.
was really watching.
Yeah,
it.
But
very
the
good.
old saying in the law, bad facts make bad law. Well, in this instance, great facts should make better law.
Right.
And this is why the stories like that about people who are getting hurt are important.
Yes.
And you in Congress take full note of that.
Yeah.
And hopefully your colleagues on the other side of the aisle will take note of it too.
Well,
because their people are getting hurt too.
Yeah, just the tariffs obviously started a trade war, with China, and
Sure.
Trump was bragging about the deal that he negotiated in Beijing to buy some of the soybeans that have been basically piling up in bins there. But there was already a report today that China's backpedaling, because they actually have a surplus of soybeans from all the soybeans they bought from Brazil and Argentina. So, again, you can't trust their promises in a lot of ways.
No.
They said those islands they were building were never going to be militarized, and they've been militarized.
Yeah.
But, that's the point is that the power of setting taxes and tariffs was put in Article I for Congress for a good reason, which is that it can really destabilize people's lives and the economy if they're not handled well. And Canada, the Prime Minister or the Premier of Toronto ran an ad using Reagan.
That was great.
But then Trump wakes up the next day and doubles their tariffs because he's mad about a television commercial.
It's like a
That's never happened to
It's
a
like
politician.
Like a child out of control.
Yeah, no, it's very,
sorry, I
very,
shouldn't
very.
say things
No,
like
it's
that,
been.
but-
But anyway,
could
no,
do
that's.
worse.
But that's. And look what happened with the farmers now. Whether it's the cattle or it's the soybeans. The soybeans here.
Yep.
Hopefully they'll be able to. They aren't going bad. That maybe the surplus will take them. But Doge took the surplus administrative people away. So I don't know what's going to happen with any surplus
and
food
then
the farms
today,
have.
he
Yeah.
announced that he's taking the tariffs off of bananas and coffee, which never should have been on there to begin with,
course
because we
not.
don't produce
Right.
bananas or coffee. But when you think about it, he was doing it because I want to lower grocery prices. Well, yeah, that's what will happen because it's a tax. Brazil never paid it.
No,
for
we pay it.
bananas.
Bananas are still pretty cheap.
No,
I
I
go
know.
shopping sometimes.
I agree,
no.
but coffee's not.
Coffee's not.
No,
yeah, that's
coffee's
right.
it's doubled actually.
That's right.
Yeah, I know because I drink a lot of coffee.
Yeah.
So we want you to.
Last 2 minutes.
We want you to
Say whatever you
summarize.
want.
Yeah, please
You're on.
tell us.
So look at one thing I think is so powerful, like the story of that apple orchard, or
Yeah.
the constituents who's are small businesses who are taking the hit. I mean,
Right.
what I would just say to your listeners, as you sort of talk to your friends or personally run into these situations, don't assume that you, Susan Johnson, or myself, are clairvoyant or are fully understanding. We want people to contact our office and
Yes.
share those stories, because I mean, in many ways, it's the most powerful argument in terms of how you change things. And the Marjorie Taylor Greene story about her daughter's health premiums jumping up. I mean, that made national news.
Yeah.
Right.
That and it's and frankly, that's happening in to millions of people right now. And I would just really encourage people to call our office in Norwich, email us, share your stories. Believe me, you're not alone. We're getting a lot of those.
You can Google Joe Courtney, Congressman Courtney, and you can Google me as well.
Yep.
And plus, sign up for the podcast here and get my e-blast every week. And you can hear this radio show, and I blast it all over Connecticut if you want to sign up for it.
Great. Well, again, it's always a pleasure to
Yeah,
be
we're-
with you
we're
guys.
absolutely
and congratulations on a great special session.
Oh, thank you so
No,
much
I
for
mean,
that. No,
good for Connecticut.
Yeah, Connecticut did a good job. We're gonna have good things, and I'm gonna have you back, Congressman Courtney, to talk some more about what you're doing. Because
Yep.
congratulations on your vision about what we should have for healthcare. I know you understand it, and I know that you'll be working really hard, as you always do, for Eastern Connecticut and for healthcare.
Thanks, Susan. Thanks, Dennis.
Thank you.